Coming up, not everyone has an understanding of the vaccine or the sign-up process. That's why Bristol Hospital has dispatched a team to visit places like bodegas, barber shops, and coffee shops this week. There were Spanish speakers in the group bearing vaccine information pamphlets. It's an effort this coffee shop owner told Eyewitness News he thinks will help his customers.
They need interpretation. They need explanations on how it goes. It's complex, man. I think this is a lot. People have dealt with a lot over the past year, and we got to help them understand it.
Here with more on that effort is Albert Pagero. He's manager of emergency preparedness at Bristol Hospital. I know, Albert, you were part of that group that was out there and setting that up. What was the goal as the rounds were made in the community?
Yeah, Eric, Bristol Hospital, we understood the data that the governor's office released. And our goal, as Jeff said, and all vaccine providers, is to get the vaccine out to as many eligible recipients as soon as possible. So our goal, when we went out into the community, hit the pavement, immerse ourselves into the community, is to understand what questions they had and make information accessible to them.
Do you find there are a lot of questions, particularly in some of the communities that maybe don't have good reach with some of this information, some of the people you talk to in barbershops and bodegas, that there's concern and there's questions and that information is needed? Is that what you're finding?
Absolutely. There's so much information out there. And as Eduardo said, having the wrong information is even worse. So our goal is to get out there, speak with communities. I come from a Hispanic background as well. So able to connect with people at the language that they speak has been extremely helpful. And just letting people know that we are here to support you on your efforts to navigate and understand the COVID-19 vaccine, distributing pamphlets in their native language, and letting them know that these vaccines went through the appropriate channels, the appropriate clinical trials, and are authorized for emergency use by the Food and Drug Administration.
And do you find receptive audiences when you get out there? I mean, I know you have a lot of questions you have to answer, but what do you find on the other end?
Yeah, as soon as we can help them understand that this vaccine is safe and it does save lives, we are seeing people saying, where do I sign up? So Bristol Health has actually, thought of creative solutions. So we've done a couple things. We've gone out to hit the pavement, distribute flyers about how to schedule your vaccine. We're also planning an informal coffee chat so people can come in and just have their questions answered. We've also done registrations and events. We partnered with the American Legion and done over 500 people that we've got, they leave the doors with an appointment in hand. Just last evening, we did one with the NAACP, which has been very successful. And that's really our goal is help support people to navigate how to get an appointment and really get in so they can roll up their sleeves and get their shot.
All right. Well, we hope that effort is successful. Certainly reaching those communities of color and some of the minority communities is so important. Albert Pagero, manager of emergency preparedness, I should say, at Bristol Hospital. Thank you for your efforts and thanks for being with us. Coming up later here on CT21, we take on time change and the annual rite of springing forward and falling back. But next, sports betting and recreational marijuana, two hot topics at the Capitol. We'll break them down right after this.